If you or someone you love is dealing with that nagging, persistent lower back and leg pain, the whole question of surgery, well, it can feel really heavy. So today, we're going to try and make that decision just a little less daunting. We're breaking down the essential guide to lumbar spinal stenosis, or LSS, drawing from the incredible work of Dr.Sayeed Hilal. So, here's our game plan. We're going to start with what's actually causing the pain. Then we'll walk through all the non-surgical stuff you should try first. We'll pinpoint that moment when surgery becomes a real conversation. And then we'll arm you with everything you need to make a choice that you feel good about. All right, let's get right into it. Because look, to really get the solutions, you've got to understand the problem first. What is actually going on in the lower back that's causing all this trouble? Okay, so at its very core, LSS is a space problem. Just imagine the tunnel in your spine where all your nerves travel through. That's the spinal canal. Now imagine that tunnel starts to get narrower and narrower. It's kind of like a traffic jam for your nerves. That pressure is the root of the whole issue, and it's usually just a result of natural wear and tear over time. In fact, it's one of the top reasons people over 65 end up having spine surgery. Now, this is what's so fascinating, the classic pattern of symptoms. It's not just about having pain, it's about when you have the pain. So if you find that standing up or walking around makes your legs feel super heavy and achy, but the moment you sit down or, lean forward on a shopping cart, you get instant relief, that is the absolute hallmark sign of LSS. So you have the symptoms. Now what? Well, it's almost never a straight shot to the operating room. There's a really important journey you take first. Before surgery is even seriously on the table, the focus is on what we call conservative care. And this isn't just about kicking the can down the road. It's a crucial trial period. We're talking about things like anti-inflammatory meds, physical therapy to build up that core strength, and sometimes even steroid injections to calm down the inflammation. The whole point here is to see if we can get your symptoms under control without having to do surgery. And that right there, that's the core philosophy. Surgery is a massive tool in the toolbox, but it is not the starting point. If these other methods can give you enough relief to get your quality of life back, then you might not need surgery at all. But what happens when that non-surgical path just isn't cutting it? What are the signs that it might be time to start a very different kind of conversation? You can really see the difference here. On the left, you've got symptoms that are, they're frustrating, but you might be able to manage them. But on the right, that's the turning point. We're talking about when the pain becomes disabling, when you can barely walk more than a short distance, or when that weakness and numbness just keeps getting worse. That's when the conversation really starts to shift. And then there are the red flags. And these aren't just about quality of life anymore. These are about preventing permanent damage. Something called cauda equina syndrome, where you lose bowel or bladder control, is a straight-up medical emergency. Same goes for a really rapid decline in nerve function. Or if your spine is unstable, like with spondylolisthesis, where one of your vertebrae literally slips forward. In these situations, waiting on surgery could have serious, permanent consequences. So a lot of times it comes down to this time frame. If you have given conservative care a serious, consistent shot for 3 to 6 months, and your quality of life is still terrible or even getting worse, that's the moment when you and your doctor are probably going to pivot and start talking seriously about surgical options. Okay, so let's get into the calculation itself. If surgery is on the table, what can you realistically expect? And maybe more importantly, what are the critical questions you absolutely need to be asking? First, the good news. The potential for improvement is actually huge. For the right person, studies show that around 80% of patients report good or even excellent results after a standard decompression surgery. That means moving better and, most importantly, getting relief from that awful, debilitating leg pain. Of course, you have to look at the other side of the coin. Surgery isn't a magic wand. There are absolutely no guarantees, and it does come with real risks, things like infection or nerve injury. So it's so important to weigh that 80% potential benefit against these very real possibilities. So to make a truly informed choice, you gotta ask the right questions. Start with this one. What kind of surgery are we talking about? A simple decompression where they just make more room for the nerves is a world away from a spinal fusion, which is a much bigger deal with a much longer recovery. Next, you have to make it personal. The outcome isn't just some statistic. It's about your body, your age, your other health issues, how severe your stenosis is. It all plays a role. Your surgeon should be able to sit down with you and help you set expectations that are realistic for your specific situation. And finally, ask this. What's the cost of doing nothing? In some cases, waiting might not change much, but in others, especially if you have nerve weakness that's getting worse, delaying it can actually make a full recovery less likely. Understanding this really helps you figure out how urgent the decision is. Okay, let's say you and your doctor agree that surgery is the right move. The journey isn't over. In fact, a whole new one is just starting, and how you prepare for it is everything. A successful result really starts before you even get to the hospital. It means getting your health in the best shape possible, like getting your blood sugar under control or quitting smoking. And it also means thinking ahead and setting up a support system for when you get back home. After surgery, the whole game shifts to rehab. And it's a gradual process, right? It starts with just walking, sometimes on the very same day as the surgery, and then it builds with physical therapy. It is so important to follow your surgeon's instructions, especially about not lifting anything heavy, to protect all the work that was just done.
So, we've walked this whole path together, all the way from diagnosis to recovery. What's the big idea? What's the one thing you really need to take away from all this?
Here it is. Surgery for LSS is a powerful tool, but it's not the first resort. The timing is right when you've tried everything else and your quality of life is still suffering. The decision has to be a partnership with your doctor, one that's driven by your questions and grounded in what's realistic for you. Ultimately, this whole explainer is designed to help you go from being just a patient to being an active partner in your own healthcare. So I guess the only question left is, with all this information, are you ready to have that informed conversation?